Syphilis is a bacteria which is usually passed on through sexual contact. Less commonly, it can be passed on in other ways, such as through blood and blood products, or sometimes from mother to baby during pregnancy. Often, it doesn't cause any symptoms, but for some people, they can notice a single, painless ulcer, and sometimes can get a rash which can affect the chest, or sometimes the hands or the feet. After a long time, so after 10 or 20 years or more, for some people, if their syphilis hasn't been treated, it can affect different parts of the body and cause problems with their nerves or the heart. And that's why it's really important to have a screen for this infection. If it's treated properly, then you would not be at risk of these complications. Syphilis is treatable and curable with antibiotics, and that's usually an injection of penicillin, although we do have other alternatives if you're allergic. After having the treatment for syphilis, as the bacteria dies in the body, it can make you feel a bit poorly over the next day, sometimes with a headache or muscle aches. But if you rest and take simple painkillers such as paracetamol, this will pass quite quickly. It's really important to avoid sex whilst you're treated for syphilis and until you've had the right follow-up. Your doctor will be able to advise you how long this is for. It's really important to have the right follow-up for syphilis because although the bacteria is treated and cured and leaves the body completely, we can still see the memory of this infection on your blood test. If you have the blood test again in the future, it's helpful that we know what treatment you had and what your blood test in the past showed. It's really important to remember that it is possible to catch syphilis again in the future, and condoms can reduce the risk of this.